I'm Lauren Stauser.
And I'm Andrew McCarthy, and we're here to present on South African healthcare.
So basically, the healthcare in South Africa is free for specifically basic needs. But Africare is a company started in 1992 that invests in South African communities through projects addressing HIV, AIDS, treatment for tuberculosis and STIs. They have a specific project now called the Africare's Injongo Yithu, which is based in the Eastern Cape, and the Eastern Cape holds the third greatest HIV population, and it is also the second largest and poorest area in South Africa. Recently, 3 years ago, they expanded and they now have, they went from 79 to 112 hospitals and have been expanding from 12 to 51 community-based organizations in order to help the people in the Eastern Cape. They have gotten excellent performance, so the donations and investments have grown. This is just a thing that they have on their website discussing how they take their core expertise of capacity building, community engagement, and apply it to health as well as agriculture, but mainly health, and they are looking for cross-cutting themes where they can build on, such as women's empowerment, youth empowerment, and through that they run these projects in order to create a better life for these people. Like I said, all basic medical care is free. However, the medical care that is given to poor and rural communities is inferior compared to those who have the money to have private health care. Hospitals in poor areas are overcrowded, and also many people have to travel miles in order to get to these hospitals and clinics. Like I said, medical services are inferior in rural areas, and there's a huge difference between life expectancy in the blacks of South Africa and the whites and coloreds. That's why I said colors matter, because the whites have a significant higher life expectancy as well as mortality rates. They live longer, and their children being born it has a better life because of the medical care they can have. ASAP is another organization that they focus on multiple things. They train women who can be home-based healthcare providers, and they often travel far in order to help those who are sick. And a lot of the sick people are isolated in certain communities because they can't afford the medical treatment, and so the disease spreads throughout the community, and they are very far from those with better health care. They also have support groups that allow people who are infected with HIV and AIDS to talk with others that are infected, so there's a community bond over that.
So we have a little video to show you the overcrowding.
From a nation which pioneered the first heart transplant and successfully separated Siamese twins who were joined at the head, one would believe that South Africa would be in the forefront of healthcare. Sadly, however, this is not true, as there are enormous gaps between the public and private hospitals. The problem arises where public hospitals are understaffed, and the staff which are there are underpaid. This has been an issue which has been raised time and again, and yet, for decades, the healthcare workers remain poorly remunerated. And thus, so many nurses and doctors are lost to the private sector. One of the most beautiful experiences a parent goes through is the birth of their child. And unfortunately, in South African public hospitals, maternity wards are often below the standard they should be at. Therefore, this experience has become one of terror rather than of joy.
That's just showing how crowded the maternal wards are for the public healthcare, and it discusses how the staff is overworked and underpaid in public hospitals, and so the medical care being given isn't as best as it should be, and the private hospitals and healthcare services are much better. I'm asking the question, how easily can one get health insurance? Because even though it is free healthcare, it seems to be an issue because they are not receiving the same healthcare that everyone is. I talk about 1 in 5 because 1 in 5 people can get private healthcare, like they can afford it, but 4 in 5 cannot. So there's 200 private hospitals that are not being used properly and are also out of the reach of 80% of the population. The gap between the whites, coloreds, and who can afford healthcare compared to the blacks is huge. They are not receiving the same benefits as everyone else, and health insurance is extremely necessary in order to live a full life. The other options are very small. As we saw before, the organizations try to provide options such as alternate clinics and supplies that someone may need, but it is not always available, and it is hard to get donations and invest in all the things we need. Apparently, the NHI, which is the National Healthcare Insurance, National Health Insurance, discusses how they will be building new hospitals and clinics. They talk about 43 new hospitals and 213 new clinics in the next 5 years. But at the rate they've been going for the past couple, it seems that it will be slowed. They also discuss refurbishing and rebuilding 870 new clinics, but this is all government-based money, and it's unreliable in the sense that it's not, the government can't just specifically focus on this when there's other issues arising in South Africa.
So one of the biggest problems in the healthcare system in South Africa is the high prevalence of HIV, AIDS, and tuberculosis. So in 2013, the data collected showed that there were over 6 million people living with HIV. There were over 200,000 AIDS-related deaths that year and 300,000 new infections. They're still working on the current estimates for 2014, but they're estimating that 6.8 million people are currently living with HIV, and that's about the population of Massachusetts, just to give you an idea of that. So because of these diseases and their increasing prevalence, there has been a decrease in the life expectancy by 10 years in the past 15 to 20 years in South Africa. So like Lauren said, a majority of the healthcare in South Africa is government funded, and that's why it's free to the general population. And because it's so prevalent in the black population, they have to go to the public sector to get this treatment. So the government invests over $1 billion annually to combat HIV and AIDS alone. So although they're investing all this money into it, HIV prevalence is still around 11% nationwide. It's highest in the population of 25-year-olds to 60-year-olds at around 19.1%. And in some areas, such as the KwaZulu-Natal region, it's 40% prevalent. So in general, HIV and AIDS is more common in the female population, and it's about twice as common. It's most prevalent in men ages 30 to 34 and women 25 to 29. And it's a lot higher in the black population. The prevalence in the white and Indian population in South Africa is less than 2% each, showing you how big of a problem this really is for the black population. It puts such a strain on the healthcare system because 46% of all patients that are admitted to a hospital are HIV or AIDS positive. And because of AIDS and their compromised immune system, they end up spending 6 more days in the hospital per visit, which is about 14 days in total that they stay in a hospital, which is more money being spent by the government to get them better. So there was a comprehensive study called the China Project, which was in like the mid-2000s, and it kind of just looked at the overarching problems HIV and AIDS had in the healthcare system, and it reported that basically it's just as bad for the healthcare workers as it is for the people who have these diseases. So the workforce in South Africa misses about 60 days of work a year, and with the increasing prevalence of HIV and AIDS, there's been increases in absenteeism and decreases in performance. In the year 2004 alone, 4,000 doctors left the workforce, and between 2000 and 2004, only 4,000 doctors matriculated through med school, so it essentially undid 4 years of work. So, although AIDS is a huge problem in South Africa, it's also a huge problem globally. So the United Nations kind of came up with this whole vision where there would be 0 new HIV infections, 0 discrimination, and 0 AIDS-related deaths. And although this isn't going to be possible in the near future, this is ultimately what they're working towards. So this focus they have 4 main pillars, and it's to prevent mother-to-childhood transmission, encourage the use of condoms, encourage voluntary male circumcision because this reduces female-to-male transmission by 60%, and they want to increase education and awareness on HIV and AIDS. So based off of that whole vision by the United Nations, South Africa put forward their ART program, or the Antiretroviral Treatment Program. So this was implemented in 2008, and there's been a 75% increase in HIV treatment. Life expectancy in some areas is as high as 80% as like the normal population, and currently there's over 2 million people on this plan. But the problem that this has created, because the rural areas are so underserved, is task shifting, which basically means that nurses have to do the roles of doctors in these areas, so they're the ones administering this treatment, even though in America it's performed by doctors. So we can't talk about AIDS and not bring up tuberculosis because these two go hand in hand. So when the AIDS epidemic started in South Africa around 20 years ago, there's actually been a 400% increase in tuberculosis there. So, and this is because people with HIV are much more prone to developing it, and current estimates say that 70% of people who are HIV positive also have tuberculosis in South Africa. So TB is actually the leading cause of death, and it's, for most patients with AIDS, it's what's their primary cause of death on the death certificate. And this also increases hospital visits and frequencies and visit durations, which also falls on the hands of the public sector to cover. So although HIV/AIDS are a huge problem in the South African healthcare system, projections say that the government can actually cover all these treatments using their own money, which is like gained international applause, because there has been declines in HIV prevalence since the government started investing all this money, and other countries are starting to implement similar plans, like in India and China, where they also have similar disease traits. And the UN has recognized them for the ART program, which has done wonders there. And that's it.
Questions? Justin?
So you guys said that the medical services were inferior in rural areas, and there's a huge gap between the different races and colors in South Africa. What is currently being done to fix that in South Africa?
Currently, they're trying to, they say they're gaining money to raise money for clinics to be built in the rural areas so that people don't have to travel as far in order to get the health care they need. They're also trying to raise money to get the best supplies as the private healthcares might have, but it's a slow process because the government puts so much money in, but also it's not enough for the public. It's specifically going to the private healthcare.
And going off of that, they started implementing task shifting, like I said. So because they have a shortage of doctors, they actually have nurses performing a lot of roles doctors do, and that's pretty much specifically in rural areas where there are no doctors practicing.
So how does that compare to the United States?
Recently there's kind of a shortage of primary care doctors in the United States, but the availability for treatment is still there for something like HIV and AIDS, and doctors are the ones who administer that treatment here. But in the United States, you've seen like the rise of physician assistants and nurse practitioners to replace the shortage of primary cares. In South Africa, they're just having nurses do these jobs without like the proper training and education almost. So at the same time, it has been effective, but it's a huge risk giving someone that much responsibility.
Other questions?
Did you find like any other outside organizations from around the world with like donating their time or their medicine, how they do in other poor countries?
Yeah, so there's like I know Bill Gates donates a lot of money to this, but one of the problems is the money that's spent on HIV and AIDS, the $1 billion annually I was telling you about, only 2.3% of that is from donors. So although a lot of money is being poured into this and being poured into HIV and AIDS, it's being poured into the research aspect of it, so it's not really helping people yet.
So you presented on ASAP and Africare at the top of your presentation. What's so important about those two organizations that you would lead off your presentation, specifically about those two? In terms of, instead of giving a general overview of the healthcare system, what about those two stood out that made it?
Those two organizations stood out to me the most because I found them helping more the local communities and those in the poorer and rural areas compared to just helping the general public per se. They were helping specifically blacks living in rural and poor areas throughout the country. Specifically, I talked about the Eastern Cape, and that's more Africare, but ASAP is they have focused training for women to be home-based caregivers in order to help out those communities so they can travel, because like Andrew said, the doctors and the nurses are overworked and underpaid, and they have to do task shifting roles, so they train essentially regular people to do these home care visits.
Thank you very much.